Hi, I'm excited to tell you today about our article published in the American Journal of Sexuality Education entitled You Don't Just Know: Difficulties in Determining Desire, Recognizing Trauma, and Accessing High Quality Sexual Education in Neurodiverse Young Adults. So, in this study, we combined data from two related studies to explore satisfaction with sexual education, in particular consent focused education among autistic and non autistic college students. From prior research, there was some evidence, particularly qualitatively, that autistic students were less satisfied with their consent education experience and their sexual education experience, and were also more at risk of various types of violations of consent. So, sexual trauma, rape, sexual assault, in a variety of forms. So, in our research, we wanted to explore this further and really look at the comparisons across autistic and non autistic young adults in terms of their experiences with consent education, as well as their experience of sexual trauma and abuse, and what they wanted from consent education in the future as well. So, our sample combined an in person study of 55 students and an online study that was actually focused on mood during the transition to college. For a total of 285 students, a little less than half of whom were autistic via self report. Now, overall, in our findings, we found that as hypothesized and aligning with qualitative findings from other research, our autistic undergraduates reported less satisfaction with consent education in childhood. They also reported higher rates of sexual abuse and trauma in childhood. And qualitatively, there was also a theme in the autistic group in which students did not recognize an experience as non consensual or traumatic or rape until months or years later. And when they did have this recognition, it was very often in the context of sexual education. So they had this realization while learning about the definition of consent, for example, or watching a video on the topic. So when we combine this information, we see this picture where autistic students are less satisfied with their consent education, more likely to experience sexual trauma and abuse, and may not realize that their experience isn't healthy or okay until much later. This is, of course, very concerning, and I think really highlights the importance of early and accessible sexual education for all students. Now, lastly, when we looked at what difficulties may exist in navigating consent, we found that most individuals did feel pretty comfortable talking about consent and appreciated being able to do so. However, there was a bit of a tension in navigating this belief that consent should be enthusiastic. So, some of our students described to us when they are trying to establish a partner's consent, they want their partner to feel certain. They want their partner to be wholly enthusiastic. They want a hell yes, as we very often heard. And then there's a little bit of a tension in terms of what they expect from their partner and what they themselves feel. Because while they want this hell yes from their partner, they themselves often feel a little bit more unsure or ambivalent or just don't maybe have quite that degree of certainty. And this isn't abnormal. When we look at literature on responsive desire and ambivalence, we know that it's really quite common to not feel totally excited and certain until something happens to build some of that excitement. But this does seem to still pose a dilemma for students. If there's this expectation of total certainty, but then they themselves don't or very rarely feel that way, then there's the question of how do you decide whether to consent? What do you do in that situation? And this is an area where we think sexual education could potentially better support students, by providing some of this information on desire and common sexual experiences and how to make these types of decisions when there is uncertainty or there is some level of ambivalence. And we think that this could be really positive, in terms of not only talking about the legal definition of consent and what is required to keep everyone safe and out of trouble, but to also include this idea of how do we build healthy, meaningful sexual and romantic lives? How do we include information on your own desire and your own pleasure, not only sort of limiting legal concerns and risk? There are so many wonderful quotes from participants in this paper. I am so grateful for their participation and their honesty and their willingness to share their stories. And there's also a lot of information in this article, so I do hope you'll give it a read at our free open access link. Thank you so much.